The coronavirus. It's been a part of our lives now in the United States since January 20th of 2020. From that time, we have seen mass testing with isolation orders, large-scale vaccine clinics, mask mandates, and much more. I sat down with our health department leaders, as well as our local hospitals, to take a look back, but also look forwards towards the future, forging ahead with COVID-19.
We, as most of the United States and the nation and the world, did not really know what we were up against.
Back in 2020, when it was a completely unknown virus, there was a lot of trepidation and fear, I would say, in what we were taking care of.
Pretty quickly, we knew that it was only a matter of time. It wasn't if, but when we would see our first cases. So from that first day, we started gearing up to enact our plans. If you'd have told me 2 years later we'd still be executing that process, I would have been quite surprised.
The Southern Tier saw its first confirmed case of the coronavirus on March 14th of 2020 in Tioga County.
Those early days before we even had a vaccine available, that definitely was probably one of the toughest times for our community.
Local health departments and hospitals nearly overnight became the epicenter of information and treatment for this novel virus.
One of our greatest challenges was trying to be the resource for answers when answers were very few and far between. The science was very rapidly changing. What we knew about the virus changed sometimes hourly. State guidelines changed. They were different in the morning than they were in the afternoon.
Essentially, back in 2020, the hospital essentially had to remodel itself on the fly. As this is an airborne virus, we did not have the infrastructure immediately set up to make sure that we had the capability of turning almost every room in the hospital into a reverse isolation, which means that we can basically keep the virus from spreading to other rooms in the hospital.
There were times when we weren't doing elective procedures, and that allowed us to take some of that staff, that clinical staff, to do other work. There were times when there was so much necessary non-COVID care that we had to bring people in from other sites and bring them sort of to do the clinical care.
Local health departments became responsible for enforcing state guidelines, including isolation orders, mask mandates, and contact tracing, while also maintaining their other duties.
I think a lot of people forget that health departments do more than just communicable disease. We monitor all of our restaurants that are open. We help our children who are getting early intervention services. If we have rabies investigations, we're doing that. We're really doing it all. And this was the same staff that was doing those types of duties that was also doing COVID-19.
When the vaccine became available to the majority of the population by 2021, those same health departments had a new task.
Public health drills constantly for these public health emergencies, and getting shots in arms was our objective when it became available to anyone who was eligible. So setting up the ice arena was something that we had drilled for in the past. We had done during H1N1, a very similar situation and setup.
Meanwhile, hospitals built up new tools to care for patients and strengthen their relationships with local health departments and each other.
We had to almost turn on the dime and start to use telemedicine as almost an exclusive means of taking care of people in the outside population, as they weren't allowed to go to their houses, and they were definitely fearful of going into any doctor's offices. So we were able to aggressively pursue that option. We were able to get nationally recognized and certified as a telemedicine provider, one of the first ones in the country to get that recognition.
There's a remarkable interconnection with public health that just didn't exist this robustly 3 years ago. And so we learned from them, they learned from us, and we worked together much better. And then the actual facilities, those that you could call our competitors. There's been so much collaboration and so much discussion about what are you facing, what are we facing. Let's make sure we look at that together.
Now into its third year, the COVID-19 pandemic continues.
We are definitely seeing the Omicron surge, and it's picking up steam everywhere. So to say that we're in the endemic phase, I wouldn't put us there yet. Because it's so unknown. This virus is able to mutate very quickly and keeps us on our toes. And so it's definitely, COVID is not behind us, and we need to learn to live with it.
While most testing is now being done at home, agencies are finding new ways to track COVID infection.
Some of the local wastewater treatment plants are testing for COVID in the wastewater, which is a very novel passive surveillance method that we hope to be able to expand on locally. But I see it as a great way to keep your finger on the pulse of activity in the community.
If we're seeing a large number of cases, but the majority of them are very mild cases, and we're not really seeing the hospitalizations and deaths, from a health department standpoint, we're not going to be as quick to react to that. If we do see people becoming severely sick. We do see those hospitalizations, we see those deaths. That's really at the point where we need to step back in and take that action.
Health departments say they continue to prepare for next steps.
I fully expect we'll have regular vaccine boosters, whether that be yearly or bi-yearly, similar to a flu shot. Time will tell. Science is still working on that. But I see us having a role in education, prevention, and response going forward, but not the heavy-handed regulated approach we took initially.
And in our hospitals,
We have very many fewer patients on ventilators or needing a significant amount of oxygen. We have people in the hospital, but they're not quite as seriously ill as they were before.
If you were to come into the hospital and take a sampling of who's actually in the hospital with actual COVID still in this day and age, it would be those that are unvaccinated, unboosted. And if you're unvaccinated, there's a high chance that you're in the intensive care unit, which is obviously not where we want you to be. So if I could make one plea to the community, it would be please get vaccinated.
The healthcare systems, not just Guthrie, but all, are much better prepared to take care of this now, and we continue to learn. Over time, we're going to know more about this virus, and we're going to know more about how to treat it and treat the consequences of it. But it's going to be a while.
departments emphasize that they take their guidance from New York State, and as the seasons change and our case counts ebb and flow, they will continue to keep their residents updated on what they need to know.